This is part 2 of the basics of chest radiography, qualities and properties of radiographs. If you haven't watched part 1 already, I encourage you to go back and look at that first. So this lecture is exciting and interesting. Don't have a bad attitude like this baby, I guess. References, so there are RSNA modules that apply to this, as well as Huda and Bushberg chapters. So there are all kinds of qualities and parameters that can describe images and how good they are, and whether there are issues or not. And so we'll go through a whole bunch of these things and talk about what can change the parameters of the image, what things you can change that will affect the quality of the image. So all kinds of things can affect image quality, things like motion, patient thickness, KVP, MA, detector type, grids, post-processing. And the main point is that depending on the task you want, you're going to have to choose an appropriate technique. So different tasks need different techniques. Mammography is going to have a way different technique than an abdomen X-ray, and thoracic spine X-ray is going to have different technique than a chest X-ray. So first characteristic of a chest X-ray would be contrast, which is a measurement in the difference in attenuation or signal or echogenicity of a lesion compared to the adjacent background or adjacent normal tissue. And so in radiography, this is the difference in X-ray intensity through a lesion compared to a nearby tissue. And this, of course, depends on what the lesion is made up of and what's near to it. But in general, scatter will degrade contrast and grids can improve contrast. Here's examples of different amounts of contrast. So this is a patella, and here's a low contrast image versus a high contrast image. And with screen film, you can graphically represent contrast, which we kind of looked at on the last thing, where depending on the amount of X-ray exposure you apply to the film, you'll get different shades of bright, light or dark on the film, and the difference between the brightest and the darkest would be the amount of contrast. Latitude is related to contrast in that it has to do with what the range of radiation is you can apply to a film and get satisfactory differences in contrast. And so digital systems have much larger latitude than film systems, and depending on what you're trying to differentiate, so if you're trying to differentiate really similar tissues like fat and stromal tissue in the breast, well, then you would want a narrower latitude. Whereas if you're trying to differentiate very different tissues like air in the lungs and soft tissues in the heart, then you would use a wider latitude film. So an example of a wide latitude film versus a narrow latitude film. So the wide latitude film, all these things that are similar to each other in amount of attenuation, you can see slight differences, whereas everything is just whited out on a narrow latitude film. So films used for chest X-ray exams are likely to have increased, I'll let you pause and think about it, they're likely to have increased latitude. So high latitude would be chest X-rays, whereas low latitude would be mammography. Okay, subject contrast is most likely to be affected by which of the following? So not something we've covered, but if you've done the modules, you might remember. The answer to this is the tube voltage. Okay, so what's the dynamic range? That means the number of shades of gray that you can detect or store. It really depends on the difference of the systems. So ultrasound would have the lower number of shades of gray, whereas mammography would have the highest. Radiography, MRI, CT, nuclear medicine would all be in between. And insert your tacky 50 Shades of Gray joke here. Okay, so what causes contrast? Well, it's differences in attenuation of X-rays. So absorption and scatter of X-rays is what causes differences in attenuation. And it follows exponential decay, meaning that the amount of attenuation is not linear, but it's exponential as you go through material. So the number of X-rays reaching the detector varies inversely with the thickness of the object. So the thicker the object, the fewer X-rays, obviously, and the linear attenuation coefficients are what can be used to describe this. So X-rays usually traverse multiple materials that have different linear attenuation coefficients, and then you can add those together up in the exponential part. So soft tissue contrast is your ability to discriminate different density materials, which is basically a function of your photon energy. So lower photon energies give you higher contrast, meaning that at lower energies, different materials in the body will have greater differences in the amount of absorption, whereas at higher material energies, those photons are more likely to just pass through the body, and so you don't get differences in the amount of attenuation. So here's an example of just differences in attenuation. You can have air, fat, and heart, and if you can see differences between those. And you can have soft tissues, stromal tissues versus fat tissues in the breast. And metal would be very attenuating, would have a high linear attenuation coefficient. And then iodinated contrast and barium also would have high coefficients. So this is just an example showing how different X-ray beam energies will have different amounts of contrast. So a low energy beam will be blocked, will attenuate a lot within the bone, but not very much within the lung. And so your difference in the amount of X-rays that reach the detector will be very high. So you'll have high contrast. Whereas if you have a high energy beam, a lot of the X-rays will pass through the bone and a lot will pass through the lung. And so you'll have lower contrast with a higher energy beam. So two structures that are of similar density, if they're right next to each other, they appear as a single object. But if they're not right next to each other, then you can see the edges, and that's called the silhouette sign. So here's an example. So if you have a pneumonia in the lingula, all that pus in the lung is going to be similar density to the soft tissues in the heart. And so if they're right next to each other, you won't see the heart border clearly. Whereas the pus in the lung, if it's not right up next to the heart border, if it's just behind the heart, you'll still be able to see that line. And so it's a trick for telling a difference between like a lingular versus a lower lobe pneumonia. This is an example of how that works on more of a phantom or a cup with water in it. So the glass and the fluid from the side, when they're touching each other, you cannot see them. You can't see that there's a difference. But when you look at it from the top, you can see that there's a difference in the attenuation. Here's an example of just a fat fluid level where when that fluid, you can see the difference because there's a tissue interface. Mach bands is another thing that is an issue with interfaces. It's an optical illusion of exaggerated contrast that you see between the edges of slightly different shades of gray. And basically it's a physiologic effect of the way your brain and your retina process images. So when you have a change in brightness and darkness, if you have something white here and black here, and then there's a sudden transition from white to black, the amount of light reaching your eye should be exactly, should follow this shape, for example. However, what happens is your eye overcorrects, and so it makes it look like you've got this dark, and then it looks even more dark before it looks more bright, and then goes to regular bright. And so that's what you see, is you see this accentuated band at a tissue interface. And so examples of that, you can see that along high contrast borders in the body. Some of these don't project super well, unfortunately. Hopefully you can see a little bit on the videos how maybe things look real dark right there, or maybe a little bit lighter on the other side of it. Another example here where it looks like there's a dark and a light line there. Another example here, I feel like this one I can see pretty well, where it looks like there's a dark line right there, which is fake, which is different and can confuse you from a true pneumothorax. You'll see kind of a dark band and a bright band along the edge of a bone between soft tissue, and that can confuse you and make you think it's a fat pad, which is here. Here's a true fat pad displacement from a shoulder fusion from a occult fracture. Of course, there's the sale sign there as well. This is really easy to see, I think, on this phantom. It really makes it look like there's a dark and a light line there where that air to soft tissue interface is. And then this also has a little bit of a dark halo around it. Okay, so resolution. Resolution of radiography or of any system really is your ability to display two adjacent objects as separate entities, so your spatial resolution. And this would also have to do with your sharpness or blurriness. You can quantify this in radiography using a bar phantom, and you can describe it in line pairs per millimeter. So if you have one line pair per millimeter, that means that the lead line is half of a millimeter because it's a line pair per millimeter, so there's a half millimeter line. And two line pairs would be 0.25, etc. So if you want to be able to differentiate large objects, you only need a low number of line pairs per millimeter, but if you want to differentiate small objects, you need high line pairs per millimeter. The resolution of your eye is somewhere between 5 and 30 line pairs per millimeter, and it really depends on conditions and distance. Well, different techniques and modalities will have different resolutions. So nuclear medicine and then MRI are kind of our lowest spatial resolution techniques, and then also CT will be lower spatial resolution. And highest spatial resolution would actually be screen film radiography and mammography. Those would be our highest resolution techniques. Examples of high versus low resolution images. So radiographic spatial resolution can be best improved by reducing what? I'll pause this, let you think about it. Okay, so this goes back to that last lecture where your detector thickness, so the thicker your scintillator is, the detector is, the more scatter there'll be within the detector, and so you'll have lower resolution. So if you can decrease that, if you reduce the detector thickness, you'll improve spatial resolution. Something to know about spatial resolution and digital imaging is that film, which uses atoms, is inherently going to have higher resolution than digital imaging, because digital imaging uses manufactured pixel detector elements that are going to limit the resolution, and so inherently atomic chemical processes are going to have higher resolution. So, and the smallest part of your image receptor has to be smaller than what you're trying to image. So just different examples of spatial resolution. So this would be a low spatial resolution MRI versus a high spatial resolution MRI. And it's pretty clear the difference in kind of the resolution. Noise is another thing that can describe images. So noise is random variation in the amount of signal, and it comes from quantum model, both in the detectors and then in the electronics of the machine. As you have less signal, the amount of model relative to that signal seems worse. And so the lower number of X-ray beams or the less amount of signal that you're getting, the more noise becomes an issue. And so model appears to be worse as you have fewer X-ray beams relative to the signal. So this is just an example of a noisy image over here versus a less noisy image. So we talked about quantum model and how the amount of signal, the number of X-ray beams you're getting relative to the model will change how much you perceive the noise. So if you have a higher number of X-rays, then you'll have a decreasing amount of visible model. So this is an example of that. So if you have a super low dose, then the amount of model relative to that will appear very high, whereas if you have a high dose of X-rays going through it, the amount of the model basically gets overpowered by the large amount of X-ray beams, and so you have less noise and you have better contrast. So how do you quantify quantum model the best way? Well, the best way would be to, I'll let you pause and think about it, and then I'll tell you the best way would be the detector error curve. So the number of X-rays reaching the the detector would best predict your quantum model. So the next concept would be, how do geometric relationships affect all of these characteristics of film? So geometric relationships, so distances, can affect the images. So the X-ray source to the object distance, the object to the image receptor distance, and the source to the receptor distance are the typical things that are described. So you have the source to object distance, object to detector distance, and source to image receptor distance. Other things that can affect your images would be the size of the focal spot of the X-ray source, and then those things can affect amount of magnification you get. So resolution and your source to object distance is something we're talking about. So your X-ray source is not going to be an exact point. It's actually going to have a size. And so the X-ray beams that are coming out from that source are going to be going from this side of the source and also from this side of the source. And they're going to hit the edge of whatever object you have, and then there's going to be blurring. And so the closer the source is to the object, the more blurring you'll have at the edges. Whereas the farther the source is, the less blurring you'll have. The issue, though, is the farther the source is, the more powerful source you're going to have to produce enough X-rays to get to the patient from far away, because you're going to have the X-rays kind of dispersing over space. You have the inverse square law. And that's basically that the amount of X-rays that you release, they get spread out over a larger area as you go away, so the intensity of the X-ray beam goes down by the inverse square. And so there's just more things illustrating the inverse square, that basically the farther away you go, the more the X-ray beam is diverging, and that same amount of X-ray imaging is spread out over a much larger area, because the volume of the area that you're radiating, and so the intensity is much lower. Another thing that can cause blurring at the edges is the size of your focal spot. That might make sense from those images we looked at before. In terms of if your focal spot is this big, then there'll be more differences in the direction or the angle at which the X-ray beams are hitting the object, whereas if you have a small focal spot, then there'll be less of that. The issue is that smaller focal spot also has more issues with overheating. So this just shows that. So this would be a small focal spot versus a large focal spot. So a small focal spot, the beams that are coming off of that focal spot are only going to create a small amount of blurring, whereas a large focal spot, what's seen by the object, basically it creates more blurring. Something else that can affect blurring is the distance from the object to the detector. So the closer you move the object to the focal spot and the farther from the detector, you'll get magnification, but you'll also have more issue with the blurring of the edges. And this is an example of that with a flashlight. You can see there's some blurring around the edges, and you can, if you've ever played with shadow puppets, I mean, like everybody has probably thought about this, as you move your hand closer to the flashlight, you'll get more magnification, but you'll also notice that there will be more blurring, whereas if you move your hand immediately adjacent to whatever you're making the shadows on, the wall or whatever, you'll get a much sharper outline of your hand, but it won't be magnified. So these are things to know for your test, is how your resolution, magnification, resolution and magnification are affected by moving your object and your source and your detector, and then also understanding how focal spot affects your resolution or the blurriness. So if you have your object right on the detector, you will have high resolution, less blurring, but no magnification. If you move the object closer, to the source and farther from the detector, you'll have magnification, but you'll have more blurring. And then if you increase the size of your focal spot, you'll also have increased blurring. Okay, so if you move a patient closer to the X-ray source, what will that do? So we know that it will increase your blur, and then also it will decrease your noise by decreasing scatter, which we'll describe in a little bit here. Okay, so magnification. So if you take an object and you move it closer to the focal spot, you'll get more magnification, kind of like these drawings show, but you'll also get more geometric unsharpness. You'll see this sometimes with fluoroscopy. This isn't used a whole lot, except it is used in mammography. So you choose different parameters of your imaging technique for different imaging tasks. If you have a smaller focal spot, you'll have less blur, but you have issues with overheating if you have too small of a focal spot. So depending on the amount of radiation you want to use, that may or may not be a problem. And a lot of machines will have multiple focal spots, and they'll automatically change between them depending on what task you've told the machine you're trying to do. If you increase the source to the object distance, you'll have less blurring, but you have to have increased tube output, which can again cause problems with heating. If you increase the object to detector distance, you'll have more magnification, but you'll also have more blurring. Okay, scatter grids. So scatter is an issue, especially at higher kVps, that reduces image contrast. And so the more scatter you have, the less contrast you have, because you're getting more X-ray beams where they're not supposed to be, and it basically creates a blurred image, or an image where everything starts to kind of look the same with the more scatter you have. So one way to deal with that is especially at higher energies where you're more likely to have scatter, is by using grids. And what grids do is, if you have a grid that's properly oriented so that the X-ray source is aligned with the grid, then only beams that have traveled through the patient without changing direction will reach the image detector. And any beams that changed direction will not be able to go parallel through the holes, and they, at least theoretically, would hit the edges of the grid. This doesn't always occur, of course. Of course, you could have a scatter that's just right, that you can still go through the spaces in the grid. And then you can also have non-scattered photons that are absorbed by the grid because they hit the edges of the grid. So you have to use more radiation because you're going to lose some of your good photons to hitting the beams, but overall you'll get higher resolution and higher contrast. So these are just things that we talked about. There's also characteristics of the grid, like the height to the width ratio, that will affect how much of the how many X-ray beams it lets through, how exactly parallel they have to be. So the higher the grid is relative to the width, the better it will reduce scatter, but then also the more radiation it will absorb, and you'll have to use a higher dose for the patient to get a usable image. So that's called the grid ratio, the height to the width, and the higher the grid ratio, the more attenuating it is. Also, if you've ever heard a Bucky grid, that's basically a grid that just moves so that you can't see it. And if the Bucky fails during exposure, you'll see lines, like on this image here. Another way to try to remove scatter is to use an air gap technique, which, if you move the patient away from the detector, a lot of the scattered beams will go outside of the size of the detector, whereas the non-scattered beams will go to the detector, so you can improve your contrast that way. However, you'll also have issues with blurring of the edges, like we talked about before. Again, this isn't used a whole lot in general radiography, but it can be used for mag views in mammography. So grids can also cause problems if they're not lined up right. So if the septa are not lined up to the primary X-ray beam correctly, they will block it. So if you put the grid on backwards, or if it's on crooked, or if it's malaligned, it can cause all sorts of issues. And so the grids have to be pretty specifically set up for the X-ray machine and the distances. And so that's why grids usually aren't used for portable images, because you just can't get them lined up. So these images are from one of the modules. It's kind of hard to see, unfortunately, but it's examples of different misused grids. You can imagine where things are maybe harder to see in the center versus not on these, but I think unfortunately these images are hard. They show the differences in sort of mispositioned grids and everything, but unfortunately I didn't think it came across very well in this presentation. So Bucky factor. Bucky factor is what is the difference in dose with using the Bucky grid versus not using it. And typically you have to use a 2 or 3 time higher dose with a Bucky grid versus not to get that better contrast. So another question here, what is this artifact caused by? I'll let you pause and think about it. Okay, so it looks like there are, all the ribs are kind of doubled. There's different outlines of the heart here, so this could be really bad motion, but I actually think that this is double exposure. So they used the same detector twice and didn't clear it out afterwards. And that is the end. Thank you for listening. I hope it was helpful, and wish you luck.